Hi everyone, welcome to the Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices, where we aim to hear from young people and specialists about youth health priorities and issues affecting young people's health in the NT. A special shout out to our sponsors for this event, including Hot North, Charles Darwin University, the Northern Territory Government, NTPHN, Bridging the Gap, Ironbark Corporation and Chart Air.
I'm Sarah Clifford, and today on episode 11, I'll be having a chat with Bhavya Balasubramanya, who works as a senior research officer and lecturer at Menzies School of Health Research and Flinders University. Bhavya is a public health physician with a decade of experience serving rural and remote communities in India. She has been involved in the provision of primary health care with the motto of reaching the unreached. She's worked on a range of projects. Her postgraduate thesis was on body image perception and the nutritional status of school-going adolescents in India. Following her training in tropical medicine and infectious diseases, she's embarked on projects that looked at antimicrobial resistance among uropathogens. At Menzies, she works on a bunch of projects, including the Territory Kidney Care Project, severe vivax malaria, and the pneumococcal vaccine. Welcome to the podcast, Bhavya. Thank you so much for joining me.
Thanks for having me here, Sarah.
So first of all, can you tell us a little bit about Be In It NT project that you're currently working on?
All right, so Be Part of It NT is a very exciting project for young Territorians aged 14 to 19. And this is to do with a vaccine known as the meningococcal B vaccine, which is for the B strain of the bug. This vaccine protects against a very serious and lethal disease, which is the meningococcal disease. This is caused by a bug which can infect the lining of your brain and cause young children or adults to become very sick. And 1 in every 2 people that contract the disease end up dying. So it's quite serious. It is a relatively rare disease, but it's very lethal. And we are out to protect young people from a vaccine which is licensed. It's been licensed since 2014. It's in use in the United Kingdom, in New Zealand, and also recently it's been funded by the government in South Australia following a large study, which is why we're trying to roll it out in the Northern Territory for all young Territorians 14 to 19. And the second benefit of being in the study is probably an interesting question is it also has been shown to protect against gonorrhea. Now you might ask, how did gonorrhea come into the picture? So the meningococcal disease is caused by a bug called Neisseria meningitidis, and gonorrhea is caused by a closely related bug called Neisseria gonorrhoeae. So they share the same family and have a few similar genetic characteristics. So it has been shown in smaller studies in New Zealand and in South Australia that there is potential to cross protect against gonorrhea, and which is why we are very keen to roll it out in the NT to see if it has a bigger impact in
That's
our young people as well.
Oh, that's so interesting. I didn't know that. So obviously the project is focused on young people. Can you tell me why it's so important that 14 to 19-year-olds are vaccinated as opposed to someone like me who's 25?
Okay, so it's important that 14 to 19-year-olds are vaccinated because, you know, that is the phase where young people are going into puberty, they're starting their sexual lives. They probably meet their partners in school. So that is an age where young people have exploratory behaviors. They might be putting themselves more at risk. Um, and it's shown that young people in that age group, around 1 in every 10 young people carry the bug at the back of their throat, and they may not have symptoms, but they can pass it on to others through behaviors such as kissing or, you know, staying in close quarters, coughing. Yeah. So someone may not get sick with the disease, but if someone else who is less immune is exposed to the bug, they could end up having a lethal disease. So it's very important that young people in that age group are protected. We do have this vaccine for very young babies now,
Mhm.
but that's for the below 2 year olds. And we're thinking young people in this age group are definitely more at risk, and we would love to protect them.
So I understand in your role in the project, you're engaging with young people. Can you tell me about the different ways that young people are involved in the research?
Absolutely. From the word go, we've been very keen on having young people guide us through every aspect of research. So, we've had a multi-pronged approach, and we call this strategy the Be Part of It NT Plus, where we've looked at different ways. So one was trying to bring together a youth advisory group for this project, which is formed by young Territorians across the Northern Territory from Central and Top End, and trying to get their inputs on every aspect of research, from the time we went to ethics to designing a tool which was young person friendly, designing social media campaigns, flip charts, education material. We're currently working on an animation video. So it's really been guided and driven by young people's inputs, and we really recognize that because working with 14 to 19-year-olds, they're a very diverse but also a very mobile population. Some of them are found in schools, some of them are working, some of them may have flown interstate for university. So it's quite a diverse audience, and to kind of spread the word, you need young people to be giving you the best possible information. So one is through the youth committee or the advisory committee. Second one was just going and meeting groups of young people that are already established, like um, Darwin has a youth action council.
Mhm.
Similarly, Alice Springs has a youth action group. Palmerston has one. And then shire councils, and maybe places like Headspace and Red Cross Australia, which have already pre-existing youth groups which work within them. So I've been reaching out to young people there as well, telling them a bit about the project, and then asking them their ideas on how we can spread the word. How would you encourage young people to come up and get vaccinated, which is a very important aspect of public health, especially even in the current COVID pandemic. And now COVID vaccines have been announced for above 12-year-olds. So it's a very important space to be working with young people. And another forum has definitely been through the Department of Education with schools and also with universities.
Oh, amazing. So, for young people who are involved both in your project specifically, but also kind of other research projects, what do you think the benefits are for them in getting involved in a research project?
I think, I start a conversation with young people saying, "What are your thoughts on research?" And I get such a myriad of answers. Many young people have not been exposed to research before. So even just the word research makes them feel like a lab rat or a guinea pig, or am I being tested upon for something? So to bust some of those myths and to make sure that research is done in a safe, secure, and young person friendly way is a real challenge. So I think that's where we usually start our conversations, from exploring what they know and then building upon that.
Mm.
And they really appreciate having someone that they can be free with, someone whom they can talk with, no power struggles, no dominance, give them their space and their safety, and they're good to go there. I've really enjoyed working with young people for many years now, starting from my own dissertation, which was going to young people in schools, talking to them about their body image perceptions, which is a very sensitive topic, and then their nutritional status, doing some measurements. But had such an amazing response, and I really feel like one of them as well. And some of the benefits that they get by being part of a research advisory committee or feeding into research is that young people's priorities are heard. And who knows better than young people themselves when you're doing research to do with them? So I think it's very important to hear their voice and get their direction.
Yeah,
Which
absolutely.
is why we've had an amazing response with our research project as well. We also give them certificates of participation and any letters of reference they may need for their future careers. And if they take up research or anything health related, we're always happy to help them out.
Well, that's fantastic. It sounds like there's so many benefits for young people getting involved in your project and in other projects generally. You mentioned your master's project that, was it your master's? Sorry, your postgraduate thesis, where you talk to adolescents, and I believe that was in Bangalore in India. So you've done a fair bit of travel in your life. Before we wrap up, can you tell us your favorite place that you've been?
Oh, favorite place travel wise has to be the Amazon forest in Brazil.
Wow.
And it was amazing. I was on a 5 day cruise on the Amazon River, and every day we'd stop and get out the mini boats and go out to different islands. And whilst I was there, when I travel, I like to keep an open mind. I like to interact with the locals, learn their culture, maybe learn a few words from their language, because it's always a very good thing to bond with people there. And on a very tiny island off the shore of the Amazon River, I was introduced to a small primary healthcare center and a pharmacy that was operating there. And they had a very interesting model where um, young people from that community were probably sent for some training, and then they'd come back either as pharmacists or nurses or doctors. And if a community was not able to identify, the government would identify someone, and they'd have people coming in on boats, serving the community, and then going back to the city, which I thought was good. But also it raises the issue of continuity of care, people not being able to see the same faces.
Yeah.
So that was one really interesting one. Another one was when I was a global health exchange student in Israel, and just phenomenal how that country operates their technologies, even their medical technologies, seeing a barotrauma center, looking at how they grow fruits and veggies in a desert land utilizing seawater, and unfortunately, when I was there, we had a missile land just a few yards from where we were staying, and we had to be evacuated immediately. So these are the real threats people are living with, but it's also very interesting and exciting to me to be providing healthcare in such settings.
Yeah,
And
absolutely.
another one that stands out is Nepal. I was there for an earthquake relief leading a team, and each day we would pack our bags, pack equipment, pack drugs, and then set out at 4 a.m. in the morning, travel about 4 or 5 hours through the beautiful hills and valleys, and conduct outreach clinics, because due to the earthquake, people didn't have access to basic health care and drugs. So these are some of the ones that stand out, but I'm currently signed up with Doctors Without Borders, and I'm awaiting the next mission whenever it comes by.
Well, that sounds incredibly exciting. You've obviously had an amazingly full life. Thank you so much for joining the podcast today. We've really, really loved having you on.
Thanks, Sarah. And I'd just like to encourage young people, young Territorians, 14 to 19 years of age, to sign up for the Be Part of It NT study, protect themselves, protect their communities, protect people around them. The vaccine is being provided free of cost, and through the study, otherwise it is paid for by their parents and usually costs $300. So if they'd like to sign up, just go to the study website www.bepartofitnt.com.au, and I look forward to hearing from more young people. Thanks for having me today.
Thank you. That was the 11th episode of our Menzies School of Health Choice Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices.
It is always so inspiring to hear what young people, services, and health and research professionals in Australia are doing to make a difference to young people's health and wellbeing. If you can, please support the Youth Health Summit initiative by getting in touch via the Menzies School of Health Research website. Thank you for listening. Please join us again next time.